So we are going to go over 3 moves, the sideline release, the shake the apple tree, and something called the flying cowgirl. These are all moves that were taught by a spinning babies class, but we're hoping that in our unit, in our labor and delivery unit, that they can help lower our primary C-section rate. So we're just going to start off with 3 and see how they work for us. And they're all easily used with epiduralized patients. This first one is called sideline release, and the second one is shake the apple tree, and both of those can be used at any time in labor or even like pre-induction. They're just used to help stretch out the ligaments to get the pelvis and the baby in a good position, and help the hips and the bones all get in a good position too, to allow the baby to engage correctly.
Okay, keep going.
Okay. So this first one is the sideline release. So when you have a patient, you'll have her come all the way to your side, and this is baby daddy. I usually have dad or mom over here for support. Yeah, whoever the partner is. So you have the patient come all the way to their side, and you're gonna have them come. Their ligament will, over 3 to 5 contractions, will start to loosen up. And you'll actually notice their legs start way up here, and by the time you're done, it will be hanging a lot further down. So during a contraction, I always get the monitors on the baby, of course, but during a contraction, if you want to, you can gently just kind of swing their hip back and forth like this. And then when the contraction's over, you just go back to just letting it hang. I always tell patients to try, and as cheesy as it sounds, try to relax and breathe the baby out. I tell them to do some J breathing, and when they exhale, think about really breathing the baby down and out and relaxing all of their pelvic floor muscles. So it's really important to do this on both sides, because if you don't, it's going to create an unequalness in their hips. So just make sure you have enough time to do it on both sides. That's the first one. Okay, so this move is the second move. It's called shake the apple tree. It works well with me with epiduralized patients. You may feel uncomfortable getting a really dense epiduralized patient up like this. But you can always do it with help. I've never had a problem doing it, and I do it often. But you get them on their hands and knees. If they are uncomfortable like supporting themselves on their hands, you can stack up some pillows and have them rest like this, but mainly you just want their shoulders and hips flat and their back flat, and I always tell them to allow their pregnant belly to just hang. So their back is kind of arched usually. And during this one, you get a bed sheet, and you're gonna drape it over their hip bones, like so. I feel like this one works really good for malpositioned babies that are stuck. Helps them kind of rotate a little bit. So you're gonna do this 3 to 5 contractions again, and do this one during a contraction. And so in between contractions, she's just gonna rest like this and try to let her belly hang. You want to make sure her knees are like shoulder width apart. They can even be a little bit wider if that's more comfortable to her. Just whatever allows her belly to relax and hang, just like she was doing. Do that again.
What is it?
Your belly hang. Yeah. So you put the top part over her hip bones, and this bottom part is going to go up under her bottom. And you kind of hold on to it like a bicycle. And then during the contractions, you're just going to pull down and shake back and forth. And although this is the most awkward looking one and feeling one, it's the one that patients always say feels the best to them, and they feel relaxed after it's done. So 3 to 5 contractions. Yes, during the contraction, I do this. And then after, just let them rest, and you can rub their back or apply some pressure, squeeze their hips, whatever they're needing at the moment. This one is called the flying cowgirl. And it's a new move to spinning babies that they've just recently come up with. And you use the peanut ball, and it's really good for epiduralized patients, but it's specifically more for patients that are, the baby is either OP or just maybe a bigger noggin, and it's just really stuck on that pelvic brim, and it's just not descending, and it's just hitting that brim over and over again. So the way you position the patient, what it's supposed to do is help open the pelvic outlet as much as possible, or the inlet. So you're gonna have them go on their side. I'm gonna have you scoot down a little bit. You want their knee, their bottom knee on the bottom part of the bed, because you do lower it a little bit. I'm gonna have you scoot towards me. So the end goal of this position with the peanut ball is, if you think of like a bull rider when the bull is bucking, like them up in the air like this, like I was riding a bull. They're like that. So hopefully you'll be able to see it a little bit better. So all the way on their side, you're gonna put the peanut ball between their legs here, and their legs are gonna be, this might be a little too big for April. I might get a smaller one. But you're gonna pull their legs all the way back.
Holy.
So that's why even scooting a little bit more forward.
You're good.
Even scooting a little bit more forward might work even a little bit better. So yes. So this one is a little bit uncomfortable too.
A little bit.
I haven't had patients complain about it yet. So what you want to do with this one, why I wanted her knee down here, is you can see her body's in a slant and you want that level. So sometimes you may have to drop this part of the bed.
Oh yeah.
You
So
want
really
to readjust that.
Everything's about alignment.
Yes.
Okay.
And we'll get this. Might have to switch this around to get her leg to stay on there, but is it gonna stay?
Yeah.
So yeah. So after you get them in this, and they're kind of arched like that, and that pelvic brim is really open as much as it can be, then you let them lay like this about 30 minutes to an hour.
And then do you flip them over?
You don't
do
have
both
this
sides
side.
again?
They say you don't have to do that, but you can, like 30 and 30.
And it doesn't matter which side?
Doesn't matter which side, unless the
The
baby
point
stays
is
in
just to
clinic
get
and
that
can tell
brim.
which side the baby. Yeah.
Okay.
My brim feels stretched.
It looks stretched too.
Yeah. That's it.